Now, there are 6 different types of synovial joints, and they're categorized based on the shape of the articular surface as well as the movement the joint is capable of. Now, in plane joints, the articular surfaces, they're essentially flat, and they allow only a short non-axial gliding movement to occur. So examples of gliding joints we looked at a little bit earlier are at the intercarpal and interstitial joints. In hinge joints, the cylindrical end of one bone, it conforms to a trough-shaped surface on another. Now, motion is along a single plane and it resembles that of a mechanical hinge. Now, uniaxial hinge joints, they allow for only for flexion and for extension to occur. Now, in a pivotal joint, what we see here is that the rounded end of one bone, it conforms to a sleeve or ring composed of either a bone or possibly a ligament of another. The only movement that is allowed is uniaxial rotation of one bone around its long axis. In condylar joints, also known as ellipsoidal joints, the oval articulating surface of one bone, it fits into complementary depression in another. Now, the important characteristic is that both articulating surfaces, they're oval. Now, the biaxial condylar joints, it permits all angular motions to occur, meaning you get flexion and extension, abduction and adduction, as well as circumduction. Now, in saddle joints, they resemble condylar joints, but they allow greater freedom of movement. Now, each articular surface, it has both concave and convex areas. In other words, it looks like a saddle. Now, the articular surfaces, they fit together concave to convex. Now, in a ball and socket joint, the spherical or hemispherical head of one bone, it articulates with the cup-like socket of another. Now, these joints are multi-axial and the most freely movable joint, synovial joint that we have in our body. So it allows for universal movement. Perfect examples is we see it at our shoulder joints or our hip joints as well. So in this illustration, what you can see is a plane joint, and we're looking at your intercarpal joint. You can also find these as intertarsal joints as well as between the vertebral articular surfaces. So notice the movement that we only have over here is a gliding movement, and the articulating surfaces, they're flat. This is your hinge joint over here. Perfect example is the elbow joint or the interpharyngeal joints. So notice what we have here. This is your cylindrical shaped bone up over here, and then you have this trough shaped bone down over here. So this is where you're going to get this bone fitting over here with this bone. So here you go. You can see it. The ulna is the example of the trough over here, and then the humerus bone. It's going to be the example of the cylinder shape structure of the second bone. And what this type of motion allows for is for flexion and for extension to take place. So again, we state that this is uniaxial movement. So in this illustration here is an example of a pivot joint. Now, what you're looking at over here is the proximal surface between the radius and the ulna. Also, you find this at the atlantoaxial joint. So what you see over here is in one bone, or one side, you have a sleeve that forms, and that could be either bone and a ligament. In this case, you have a ligament, and then you have the rounded bone that's fitted within it. And what this will allow for is uniaxial movement of only for rotation to occur. Now, this is an example of a condylar joint over here, and what we see over here are that both articulating bones, they are oval in their surfaces. So you have in this picture, this is an example of the metacarpal phalangeal joint or the knuckle joint, and what we see here is that we end up getting this biaxial movement. So the movement. One movement allows for flexion and extension to take place, and that's going to be along the medial lateral axis. And along the anterior posterior axis, we get abduction and adduction taking place in this condylar joint. Now, as I said, the saddle joint, it resembles the condylar joint, but remember, in the condylar joint, the shapes were both oval, and that was a key distinguishing characteristic. In the saddle joint, one area is concave and the other is convex, but it's not oval in its shape. So this example occurs at the carpal metacarpal joint of the thumbs, and also the motions that you get over here, they're biaxial movement. So again, for anterior posterior axis, you're going to get adduction and abduction, and then for the medial lateral axis, you're going to get flexion and extension to take place. Finally, we have the ball and socket joint. Now, this is an example of your shoulder joint. You can also find this at the hip joint. So here you have the head of the humerus over here. and then it's going to be articulating at the glenoid cavity of your scapula. So what we have over here is again, you have a cup-shaped socket, and then you have the spherical head or the ball of the articulating bone. So the movements that you get over here, they are you get a medial lateral axis, you get flexion and extension that takes place along the anterior posterior axis. You'll get adduction and abduction that takes place, and then along the vertical axis, you end up getting a rotation that takes place. So again, this type of joint provides the most movement of out of any other type of synovial joint.